Hello, parents. My name is Joanne Flatley, and I have recently started working here at PAL. I'm excited to be here with you today because I have had a lot of experience working as a family partner with many parents, and I'm here to share how I have visually seen the services work for families. Especially for our visual learners today, I am sharing this screen of how I view the system. So many of us come into the system to decide what appropriate service our child needs through PAL or another resource. That can be mobile crisis, the emergency room, a school psychologist, a school adjustment counselor, a teacher, or even a friend. And we get referred by saying that our child is struggling and they need some support. And as a parent, you want to be able to find the right support. So I'm going to ask you to bring your attention to the middle column and the bottom, where it says outpatient therapy, medication management. Many families stay in that box. Many children get the support they need through outpatient therapy and medication management. And this can look very different. You're referred by your pediatrician to a therapist. It can be a cognitive behavioral therapist, or known as CBT. It can be an exposure therapist. It can be group therapy. There's a lot of different options on what your child might need. Medication management can look very different. That can be a pediatrician prescribing medication for your child, or it could be a psychiatrist, hopefully a child psychiatrist, prescribing medication. But there are other services as well. If the child needs support outside the one-to-one of an outpatient therapy and medication management, the family can be involved. That's where family therapy, and I'll draw your attention to the middle of that column. This can be very helpful for families with siblings or parents that are struggling. It focuses on the relationship and the dynamics within the home. This can happen in an office, but also frequently happens in the family's home. The third level of clinical services is care coordination or case management. That can be provided by a care coordinator, such as an ICC, a DMH case manager, or an insurance-based case manager. All three of those are designed for clinical support for your child. And the higher the level is, the more collaboration you should make sure happens so that all of the providers working with your child are all working together and on the same page. Those three clinical services can provide referrals to the next three. If you look at the right-hand side of my slide, you cannot jump from PAL to therapeutic mentoring or family support and training service without going through your clinical service. So a family therapist, an ICC, or an outpatient therapist will refer your family or your child for family support and training. That would be a family partner aligned with the parent of the child to help support them in strengthening their support systems, taking care of themselves, while also developing the skills that they need to better manage their child's needs. Therapeutic mentoring. Similar to a peer mentor, the way I've always thought about this is that person works with my child on the skills that they're learning in their outpatient sessions and generalizing it to the community. So that work can happen in the community and should happen in the community. In-home behavioral therapy. That is, as it suggests, in-home and around the behavior of the child. This can help the family support positive behavior changes for a child that's struggling with behavior. So we would be putting in positive responses, positive activities within the family members to eliminate or at least reduce the negative behaviors in the home. So that's the way I always think about this, is that I need to deal with the individual needs of my child through clinical services and the right-hand side therapeutic services, but also how that affects my family. And that can be family therapy or in-home behavioral therapy management. I hope that's helpful. And I hope to see you guys again soon.